Fibroids are also called myomas or leiomyomas. They are benign tumors of the uterus, but can cause problems like pain or bleeding depending on their size and location. They are fairly common in women, especially in older age. They are very important to detect during pregnancy because they can grow larger and cause pain or make vaginal birth difficult. Fibroids can develop and look different in many places in the uterus. It is not important to know the names of the locations, but just know that fibroids can occur in the uterine lining, in the wall, on the outer surface of the uterus, or in the cervix. Notice that fibroids often look round. The upper images are sagittal and the lower image is transverse. All images are from the same uterus. These images show a fibroid in the posterior uterine wall. The uterine wall is the most common location to see a fibroid. Here we have labeled the bladder, uterus, and fibroid to make them more obvious. The upper images are sagittal and the lower is transverse. Again, these images are all from the same uterus. Here the fibroid is in the uterine lining. In fact, it has grown to fill the entire space of the endometrial cavity. We have outlined the fibroid here. If a fibroid has grown large within the endometrial lining like this one, it is likely to cause irregular and heavy vaginal bleeding and even anemia. In this sagittal scan of the uterus, we see a bulge on the lower anterior wall of the uterus. This is a fibroid that is located mainly on the outside of the uterus, but a part is also in the endometrial lining. These images show fibroids near the fetal head and next to the placenta. Please pause the video now to identify the fibroids within the group. Here we have labeled the fibroids, fetal head, and placenta to make them more obvious. Fibroids often grow during pregnancy. If they are large and located near the lower part of the uterus or in the cervix, they can interfere with a normal vaginal delivery. If you identify a fibroid in pregnancy, be sure to reevaluate the patient, especially in the third trimester. The patient may need a C-section, depending on the size and location of the fibroid. We cannot see the fetus in this image, but we can see amniotic fluid to the left. To the right, a large fibroid blocks the birth canal. This cervical fibroid will likely interfere with a vaginal delivery, so this patient needs a C-section for delivery. Now we will talk about the adnexal structures next to the uterus, which means the ovaries and the fallopian tubes. Please review the locations of all these structures on the diagram. As you recall, eggs form in the ovary and travel to the uterus through the fallopian tube. The ovaries normally vary in size, shape, and echogenicity. The average size of an ovary is about 3 by 1.5 by 1.5 centimeters in women of childbearing age. Ovaries are especially difficult to see in later pregnancy because they are pushed to the side by the enlarged uterus. Here are two examples of normal ovaries. In the left image, the ovary is round and solid and sits next to the uterus. The ovary in the right image has a more common appearance. They are outlined here. The ovary is normally oval and contains dark round or oval structures called follicles, which are developing eggs. The ovary produces an egg each month in a follicle. Normal follicles appear as small cysts throughout the ovary. First, we will outline the ovary. Now, we will remove this outline to better show the follicles. In this ovary, there are at least 4 and possibly a few more small follicles that are visible. Follicles can vary in size, and that is normal. Here we show both a single dominant follicle that is a bit larger on the left and a small follicle on the right. They are outlined here to make them more obvious. Most follicles are less than 3 centimeters in size, but if the follicle measures more than 5 centimeters, it might cause pain, and you should follow up with another ultrasound in 6 weeks. You cannot see normal fallopian tubes on ultrasound, but if a tube becomes blocked or infected, it may get large enough to see. The fallopian tube is also the most common site of an ectopic pregnancy. An ectopic pregnancy is any pregnancy that occurs outside the normal place in the uterus. An ectopic pregnancy usually occurs in the fallopian tube, but can also occur in the ovary, the abdomen, and the cervix. An ectopic pregnancy occurs in 1 to 4% of pregnancies. Ectopic pregnancy can be identified on ultrasound. Ectopic pregnancies are prone to rupture, and the bleeding can threaten the life of the mother. We will talk more about how to identify an ectopic pregnancy in a later lesson. Let's review the key points. The uterine position can be anteverted, midline, or retroverted. All of these positions are normal. A very short cervix is associated with preterm birth. Fibroids are benign tumors and are common. In pregnancy, fibroids can interfere with delivery when they are large and located in the lower uterus. Ovarian follicles are normal. Follicles larger than 3 centimeters can cause pain. Ectopic pregnancy can also be identified on ultrasound. Here are questions for review. Name at least 3 important structures in the pelvis. The answer is the uterus, cervix, internal cervical os, ovaries, and follicles. What can make the uterus change position? The answer is pressure from other structures like the bowel or bladder, changes in body position, and ovarian masses. Is it considered normal to have a retroverted uterus? The answer is yes. All uterine positions are considered normal. A cervix that is opening or funneling can be an early sign of which complication? The answer is preterm labor. This is also called an incompetent or shortened cervix. Why is it important to identify fibroids during pregnancy? The answer is that large fibroids can interfere with vaginal delivery when they are very low in the pelvis. Can you see fallopian tubes on ultrasound? The answer is that if fallopian tubes are normal, you cannot see them on ultrasound. If you can see a fallopian tube, it is abnormal. Thank you for your attention and interest in learning pregnancy ultrasound.